We are starting our today class on hemolytic anemia. Introduction of hemolytic anemia. What is hemolytic anemia? Definition. Anemia is a heterogeneous group of disorders of varying etiology in which blood film, blood and urine biochemistry show the features of red cell destruction resulting from intracorpuscular or extracorpuscular defect of RBC. This is the normal red blood cells, normal white cells, biconcave disc. This is blood film of hemolytic anemia. This is nucleated red cell. These are the fragmented cell. This is maximum fragmented cell. Evidence of hemolysis: elevated indirect bilirubin levels, decreased haptoglobin, decreased hemopexin, hemoglobinemia, increased urine and fecal urobilinogen, and elevated LDH. What are the characteristics of hemolytic anemia? Can develop suddenly or slowly, and it can mild to severe. Shortening of the normal red blood cell lifespan. Hemolysis occurs extravascular or intravascular locations. The red cell destruction is usually occurs extravascularly by the cells of reticuloendothelial cells, that is RE cell or mononuclear phagocytic system. Cell destruction may be acute or chronic. Accumulation of the product of hemoglobin catabolism in the blood, marked increase in erythropoiesis in bone marrow, features of anemia and hepatosplenomegaly. What are the characteristics of hemolytic anemia? General features of hemolytic anemia: general examination, physical findings, hemoglobin level, MCB, reticulocytes, bilirubin, LDH and haptoglobin. General examination: jaundice, pallor, bossing of the skull. Physical finding: enlarged spleen, liver and maybe lymphadenopathy. Hemoglobin level normal to severely depleted or reduced, MCB decreased or increased. Reticulocytes increased, bilirubin increased, mostly unconjugated bilirubin, LDH increased, haptoglobin reduced to absent. MCB decreased or increased, এটা বুঝছো? এটা বোঝো নেই। এখন যদি সিকেল সেল অ্যানিমিয়া, এটা তো হেমোলাইটিক অ্যানিমিয়া, এই ক্ষেত্রে MCB বাড়বে। আর থ্যালাসেমিয়া, এই ক্ষেত্রে হিমোগ্লোবিন কমে গেছে, সেলের সাইজ কমে যাবে, তাহলে কি হবে? এখানে MCB কমে যাবে। কজেস অফ হেমোলাইটিক অ্যানিমিয়া। হোয়াট আর দ্য কজেস অফ হেমোলাইটিক অ্যানিমিয়া? Intercorpuscular defect, extracorpuscular defect and miscellaneous causes. Intercorpuscular defect, hereditary defect, acquired defect. Hereditary membrane defect, enzyme defect and hemoglobin defect. Acquired PNH, proximal nocturnal hemoglobinuria. Extracorpuscular defect, antibody mediated mechanical injury, infection, burn, chemical injury, sequestration, splenic sequestration and destruction by splenic mononuclear phagocytic system. Miscellaneous cause not ordinarily classified as hemolytic anemia. What are the intracorpuscular hereditary defect, membrane defect, enzyme defect and hemoglobin defect? Membrane defect, that is hereditary spherocytosis, elliptocytosis. Enzyme defect, glucose 6-phosphatase deficiency, pyruvate kinase deficiency, deficiency of enzyme hexokinase monophosphate, shunt. Hemoglobin defect, hemoglobinopathies and thalassemia syndrome. Hemoglobinopathy, example sickle cell anemia, hemoglobin C disease, hemoglobin D disease, hemoglobin E disease, hemoglobin D Punjab disease, hemoglobin SC disease. SC means combination of sickle cell and hemoglobin C disease. Thalassemia syndrome, alpha thalassemia and beta thalassemia. Beta thalassemia minor, intermediate and major. alpha thalassemia silent carrier, alpha thalassemia trait, alpha hemoglobin H disease and hydrocephalus. We will discuss later in details. Hemoglobinopathies, what are the example? Sickle cell anemia, sickle cell SC disease, hemoglobin C disease, hemoglobin D Punjab, hemoglobin E disease, thalassemia syndrome, thalassemia beta, thalassemia alpha. Beta thalassemia again minor, intermediate and major. Alpha thalassemia silent carrier, alpha thalassemia trait, hemoglobin H disease, hydrocephalus. Another category alpha beta thalassemia. Sickle cell anemia, hemoglobin C disease, sickle cell hemoglobin C disease, hemoglobin D Punjab and hemoglobin E disease. Beta thalassemia, alpha beta thalassemia, minor, intermediate, major, silent carrier, alpha thalassemia trait, hemoglobin H disease, hydrocephalus. Extracorpuscular defect, what are the causes? Antibody mediated, mechanical injury, infection, burn, chemicals and sequestration in spleen and destruction by mononuclear phagocytic system. Antibody mediated, isoimmune, autoimmune destruction. Isoimmune transfusion reaction, erythroblastosis fetalis. Autoimmune, idiopathic, drug induced, SLE, malignant tumor, mycoplasma. These are the causes of autoimmunity. Autoimmunity কোথায় হবে? RBC অ্যান্টিজেনের এগেনস্টে autoimmunity ডেভেলপ করবে, করে ডিস্ট্রাকশন হবে। Mechanical injury, microangiopathic hemolytic anemia, cardiac traumatic hemolytic anemia. Microangiopathic hemolytic anemia, thrombotic, thrombocytopenic purpura, disseminated intravascular coagulation. Cardiac traumatic hemolytic anemia, ওই যে বলছিলাম, stenosis, mitral stenosis, aortic stenosis or infection, malaria, hookworm infection, burn, chemicals, lead poisoning, sequestration, hypersplenism. Hypersplenism হলে কি হবে? স্প্লিনটা অনেক বড় হবে, এর অ্যাক্টিভিটিস অনেক বাড়বে। কার অ্যাক্টিভিটিস বাড়বে? মনোনিউক্লিয়ার ফ্যাগোসাইটিক সিস্টেমের। এরা সেলগুলোকে ডিস্ট্রাকশন করবে। Miscellaneous group of hemolytic anemia, not ordinarily classified hemolytic anemia, but due to these causes, hemolysis occurs. What are the causes? Disseminated malignancy, leukemia, lymphoma, renal failure, liver disease, rheumatoid arthritis, megaloblastic anemia. This is extravascular hemolysis, this is intravascular hemolysis. Extravascular is mainly, this is the major mechanism of hemolysis. Hemolysis done by macrophage, occur in spleen, liver and bone marrow. Red cell lysis, heme extraction. Heme this destroyed to iron and porphyrin. Iron go to iron stores. Porphyrin become bilirubin, bind with albumin, go to the liver, unconjugated bilirubin, then it conjugated occurs in the liver. This is conjugated bilirubin. Then it go to the gut, urine or stool, then urine or stool. Urine, urobilin, stool, stercobilin. Intravascular hemolysis, this is the minor mechanism, occurs within the blood vessels due to mechanical trauma, immune injury, other injury, parasites, toxin and complements. Hemoglobin come out in the circulation, hemoglobin in plasma bind with haptoglobin, hemoglobin binding protein in the plasma. This complex is cleared by mononuclear phagocytic system. What are the features? Hemoglobinemia, hemoglobinuria, hemosideruria, decreased haptoglobin, anemia and jaundice. What are the consequences of hemolysis? Features of red cell destruction, features of increased red cell production, features of damaged red cells. Three features: features of red cell destruction, features of increased red cell production, features of damaged red cells. Features of red cell destruction: extravascular hemolysis, intravascular hemolysis already mentioned. consequences are anemia, jaundice, splenomegaly, gallstones. This is extravascular hemolysis. Intravascular hemolysis consequences: hemoglobinemia, hemoglobinuria, hemosideruria, anemia, jaundice, mild to moderate. What are the features of increased red cell destruction? Reticulocytosis in the peripheral blood, erythroid hyperplasia in the bone marrow, and skeletal deformities, that is thalassemia facies, frontal bossing. Clear? Features of damaged red cells: microastrocytes, elliptocytes, sickle cells, red cell fragments, nucleated red cells. তাহলে তিনটা features of red cell destruction, features of increased red cell production, features of damaged red cells. Features of red cell destruction যদি extravascular hemolysis তাহলে কি ফিচার্স আসবে, intravascular hemolysis হলে কি ফিচার আসবে। এখানে আসছে অ্যানিমিয়া, জন্ডিস, স্প্লেনোমেগালি, গলস্টোন। এখানে আসছে হেমোগ্লোবিনেমিয়া, হেমোগ্লোবিনিউরিয়া, হেমোসিডেনিউরিয়া, অ্যানিমিয়া, জন্ডিস, মাইল্ড টু মডারেট। ফিচার্স অফ ইনক্রিজ রেড সেল প্রোডাকশন, রেটিকুলোসাইটোসিস। কোথায় পাবো এটা? পেরিফেরাল ব্লাড। ইরাইথ্রয়েড হাইপারপ্লেসিয়া কোথায় পাবো? বোন ম্যারোতে। স্কেলেটাল ডিফর্মিটি, দ্যাট ইজ থ্যালাসেমিয়া ফেসিস। কেন হয়েছে বললাম? ডিউ টু ইরাইথ্রয়েড হাইপারপ্লাসিয়া। ওয়াইডেনিং অফ দ্য ম্যারো স্পেস, গ্রাজুয়াল থিনিং অফ কর্টেক্স।